If I got $1 for the number of times somebody has told me that pharmacists are drug sellers or something around that line, I'll probably be a millionaire in dollars by now, or at least I've gathered a few $100,000. And that is not far-fetched, because even I myself used to think that pharmacy was quite one directional before now, and that was because I didn't really understand what pharmacists could do. Over time, the role of pharmacists have evolved beyond just dispensing medications to being actively involved in patient care and improving therapeutic outcomes, and this can be done by the so many different ways that we now have in modern pharmacy practice. Now let's see how these different areas play a role in patient care. First, you have clinical pharmacy, where a pharmacist is directly involved in reviewing medication, identifying drug therapy problems, and working closely with other members of the healthcare team to optimize patient care. An example of this could be spotting drug-drug interaction on a prescription note. It could also mean working with the physician to review or adjust dosing regimen to fit patient condition and improve adherence. Another example would mean recommending a completely different therapy that is more appropriate for the patient. We also have medication safety and pharmacovigilance. The goal here is to prevent harm from medications, and this can be done by identifying adverse drug reactions and essentially just making sure that medications are used in the safest way possible. An example of this could be a patient coming back to say, oh, they're experiencing new symptoms that they did not have before they started the medication, since they started taking the medication. Now this is tricky because it could be the medication causing that symptom, and it could also just be a coincidence. And now, as pharmacists, you have to possibly identify if it's an adverse drug reaction. There are so many ways you can do that, and there's a video that I'm going to be talking about much later that would justify how you can identify adverse drug reactions. So you need to stay tuned so you can watch that. It could also mean picking out a potential medication error in a prescription that you know that would lead to something drastic if you don't pick it out. Another important thing in pharmacovigilance is documenting. You have to document an adverse drug reaction that has been confirmed. You know how they say if you don't document, it wasn't done, EDD. In this case, it is if you don't document it, you're putting your patient at risk of another occurrence of the same adverse drug reaction that could have been documented in their folder. And the next person that's going to attend to them is going to know that, oh, this patient reacts to this particular drug, this patient reacts to this particular drug combination, right? So if it's not documented, you are putting your patient at a risk of them having the reaction another time, which could potentially even be worse than the first time. There's also pharmacogenomics. Pharmacogenomics tells us how a patient's genetic makeup affects their response to drugs. Now, this is why you can use the same drug at the same dose in two different patients, and while it works well in one patient, it is completely ineffective in another patient, or worse still, causes terrible side effects in another patient. So pharmacogenomics helps us to personalize treatments, or to understand why treatment needs to be individualized and personalized in different patients. I hope that we get there someday in Nigeria, because it's really mind-blowing stuff. I'm very interested in pharmacogenomics. I'm so passionate about it. And I really hope that we come to a place where we can sequence everybody's genes before attending to them and just know what we are doing from the beginning, and don't be trying and erroring in medicine. I really hope that we can get to that stage in Nigeria. It's been done already in developed countries, and it's really cool stuff. For example, some patients metabolize drugs almost as soon as the drug enters their bloodstream, so the drug is not even getting to the dose that is required to actually work in their body, because it keeps getting metabolized. These patients are like ultra rapid metabolizers. Some patients metabolize drugs very slowly, so much that the drug continues to accumulate in their body and leads to toxicity. Interesting stuff, right? So understanding the different genetic makeup of our patients help us to make informed decision and helps us to personalize care in different patients. We also have drug information and research. This is another area of modern pharmacy practice that I'm quite passionate about, because it shows how evidence-based research can improve how medicines are used. can improve the experience of patients after taking medications. It involves reviewing guidelines and literatures to provide evidence-based recommendations to other members of the healthcare team. Also being able to research to get safer and more effective ways that medications can be used. So if you're a research girly like me, or you want to be a research girly, I think you can do drug information and research. You don't have to be in the hospital to be a good pharmacist. You just have to be able to research and help those that are working in the hospital have like a safer idea of how to use so and so combination, or a safer idea of how to use a particular drug. Research can be in any way. You can research across all the scopes of pharmacy that there is: herbal medicine, drug development, drug manufacturing. There's just so much to research about, really, and of course clinical pharmacy, where that directly affects patient care. Even more recently, we now also have telepharmacy, which I would like to call delivering pharmaceutical care using technology. I mean, the advent of technology has helped in so many ways, even from like electronic prescribing systems that helps us to at least reduce illegible handwritings and be able to identify what is written on the prescription sheets legibly, be able to track prescriptions, be able to identify which prescription, and also be able to importantly have medical records right. We also have AI tools that help us to flag potential drug-drug interactions like almost immediately, or even dosing issues. This is very innovative and brilliant stuff. But more importantly, technology has helped us to even make pharmaceutical care remote. You can speak to your pharmacist from the comfort of your home. You can order your medications from the comfort of your home. You can get counsel on how to use medications from the comfort of your home. And this is mind-blowing stuff that technology has helped us be able to achieve. Through telepharmacy, we can track if a patient is adherent to their medications online. Patients can be able to report adverse drug reactions by themselves. We also have like web apps that we can use for patient education and all of that good stuff. So technology has really helped us, and is still helping us be better at pharmacy. Understanding these different areas is very important, especially to us as young pharmacists, because it helps us move from just dispensing medications to being able to actively impact patient care. And this is something that I believe that you should be thinking about if you're a young pharmacist like me, if you're a student pharmacist, if you're an older pharmacist that wants to move with the trend. I believe that this is the direction you should be thinking about, and this will be a good time to subscribe to this channel, like, share, turn post notifications on so you don't know what next we're going to talk about. I kind of gave an hint about it earlier, but you can't be so sure that that's what next we're going to talk about if you don't come back here yourself to find out about it. Thank you for staying this far. I loved doing this. I hope to be consistent. You guys, let me give you one small gist about the struggles that you face as a content creator. I had recorded this video earlier. I was so sure that I was going to post this video when I was supposed to, but guess what? I started editing it and I didn't like it, and because I didn't like it, I couldn't post it. And yeah, so I really hope that I'm consistent enough to keep putting this out there, and I hope that I get all of your support. Thank you guys. See you in my next video. Bye.